The Nightlife project at Royal Melbourne was ostensibly about patient safety. We knew from looking into our data that, particularly at weekends and at night, our patients weren't as safe. They weren't getting the same treatment at 10 p.m. as they were at 10 a.m. And that was something that we couldn't ignore. The medical staff overnight were siloed. They weren't working as a team. They weren't sharing workload equally. And there was no transparency about what people were doing overnight. So nursing staff on the ward and medical teams had no connection. Certainly overnight we'd find that our MET calls for sick patients would drop off, but our code blues for cardiac arrest would go up. To solve the problem that we had at night, or the problems that we had at night, we needed a number of things. The first thing was buy-in from the people who were going to be using any system or building any system, developing any system with us. And that was really critical. So that part of the solution had to be that this was better for everybody. It had to be something that people enjoyed using, felt that it added value to their work, and allow people to connect. So the wards to connect to the medical staff, to connect to the access people. It had to be a thread that ran through that. So we actually chose to go with our system that we already had, which was Patient Flow Manager, and to approach Health IQ and look at adding an arm to PFM so that our journey boards on the ward were already Patient Flow Manager. And if we could make it a part somehow of that, it would be intuitive because it was already embedded in the system. The partnership that we built with Health IQ was really critical to the project, and one of the biggest features was that partnership didn't and couldn't end when we launched. Health IQ was so responsive. On the day, of the moment, multiple times a day, never once did they sort of say, we can't do that, we can't do it today, we can't do it by the weekend. They would just get on and do it. That was a huge selling point and a huge value add for us. My project manager and I walked in on that first night when we launched, and what we got was nurses on the ward going, oh, this is great, I love this, it's so easy. What the doctors liked about it was they could keep track of their workload, they could share each other's workload, everyone could see each other's workload. They started to connect as a team, so they started to communicate and say, hey, I can see what's on your list, would you like me to do it? And then from the nursing side, they liked that they could see when jobs were acknowledged, so they could tell that a job had been received. They could prioritise urgency so that they could sort of say this patient really needs to be seen now, and the doctor could acknowledge that. There's been a number of really big changes, and it was almost instantaneous, and it's built its momentum. And I think the biggest changes since Nightlife have been in people's attitude to how we deliver care overnight. Patient safety has definitely changed, so our MET calls have gone up overnight, which is actually good because our cardiac arrests have halved overnight. Our HMO sick leave has halved. People are actually enjoying coming to work at nights. No longer do they come in expecting to kind of just hold tight overnight till the morning teams get there. They come in ready to work, they come in as a team, they hand over as a team, and that's been a really tangible difference. I think really what Nightlife's done is integrate the entire hospital as one overnight.